Okay. First, before I will start my report, I'll just have out one question before I will start my the role unit 5, the role of organizational leadership. So, who do you think of the three leaders is the best for an organizational leader? Is it Pope Francis, who is the head of our church, Elon Musk, who is the new owner of Twitter and the head of Tesla, or President Ferdinand Marcos Jr., who is our president right now? So, any volunteer? Hello?
Kim, maybe you would like to call somebody for them to give their own opinion lang.
Okay. So, can I ask Sir John Marcon Tudtud?
Thank you, Ma'am Kim. As what I've read about the Elon Musk rather, um, her brand of leadership is like transformational. So I believe that is a good type of leadership. It's because he believes that there's a better way to do everything, and he sets his sights on constant improvement, and he has big ideas and wants to unite his team around his vision, and objectives, even if that vision and objective are outrageous. So I mean, I have nothing against the Pope or our current president, but for me, Elon Musk leadership is what we need.
Okay, sorry.
Okay.
Okay, thank you. Thank you for that, Sir John. So it's all of them are good organizational leader, but let us see who is really the best fit for or an organizational leader with our definition. So, what is organizational leadership? Organizational leadership emphasizes developing leadership skills and abilities that are relevant across the organizations. It is also a management strategy that focuses on the organization as a whole and the processes needed to unify the individual and organizational goals, as per Dr. Jennifer Trott. And it is also a management approach in which leaders help set strategic goal for the organization while motivating individuals within the group to successfully carry out assignments in service to those goals, by Sophia Tucker. So, diri mo gawas ang SMART goals, which is the specific, measurable, attainable, relevant, and time-based goals that the organizational leader needs to implement so that he or she can achieve whatever goal he wants to achieve. So, and also it is focusing on achieving the mission and vision of a company or an organization. And it is about leading and managing individuals towards achieving a strategic organizational goal. So, an organization leader is a change agent, someone who sees the big picture, but to understand the process or the steps to make change happen. So after we discuss about what is the organizational leadership, so organizational leader has its skills. And mind you, organizational leadership, mura na siya ka ng, nani siya pwede na siya eskwelahan. Mura na siya Bachelor of Science in Nursing. So in the US, they are offering courses of organizational leadership. So it's like HR, but HR they are more focused ang organizational leadership nga course is more focused siya on goal setting and all, but also focuses in the like psychological, same sa HR, pero our organizational leadership is more on motivate lang jud siya og kanang mahimo lang jud siya organization leader. Ano na siya. So what are the skills of organizational leader? So understanding the organization mission in alignment with with one's strength. Creating a strategic plan and with that mission. And implementing goals and holding team accountable for accomplishing those goals and establish timeline in alignment with the strategic plan. It also foresees possible challenges in the road ahead. It innovates to meet those challenges, and it also pivoting effectively as a circumstances changes. So ready siya in all the challenges that will occur in her on his organization. And the bottom line is he or she would remain calm amidst uncertainty. So we have that saying of JC that you need to apply the triple C, which is calm, cool, and collected. So if you are in an uncertain situation, you need to be calm, cool, and collected so that your member also will not dili sad sila mataranta because the if whatever the organizational leader show to the team, it will reflect also on the staff. They should communicate effectively because their line of instructions will all they will start the instruction and the instruction will end at them as well. And lastly, inspiring group of individuals to do their best and work towards a unified purpose. So like pareha sa mga organization like na ay mga best employee of the month, best employee of the year. So at least ma-motivate ang ilang staff to do their best also and to work hard for the organization. So what are the roles and responsibilities of our organizational leader? So there are four roles and responsibilities of the organizational leader. First is to motivate the team members. Motivation doesn't only mean pushing your people to do their job, but it also means influencing them to believe that what they are doing is for themselves and for their family. So team members respond in kind to the leader. They will be motivated to mirror the growth mindset for their teams and themselves and consider how they can personally contribute to the forward momentum of the organization as a whole. So, kinahanglan ang like it's self-explanatory. So, whatever the leader shows to the team nga willing siya and motivated siya. So, the team member is also kanang enthusiastic to share their ideas and all and also supportive. But if not, wala rasad, chill rasad ang mga team members niya. Next is allows for a problem solving and decision making mindset. So, in a psychological safe atmosphere where people are not afraid to speak up, great ideas can emerge when a leader entrusts the individual hired into their roles to develop solutions and make decisions. Exponential growth is possible. So, ang kani siya nga leadership is more on democratic, so allows people to have problem solving and decision making mindset for them to develop also the next leader. The third is promote communication, ethics, inclusion, and respect. So the highly emotional intelligent organization leader communicates in all ways that every employee's contributions are expected, as every role is vital to the organization's forward movement as a whole. The leader shares the organization's value and models the communication, ethics, inclusion, and respect as expected in each individual. And lastly, it allows organization leaders to remain goal oriented with individuals empowered to fulfill their roles and develop innovation solutions. The organization leader may focus on a larger picture, moving the mission forward with an eye on navigating the challenges started. So, allows mo na siya. So, the next is what are the quality improvement programs? Quality improvement programs have four components. All of them are all successful quality improvement programs include five key components: the problem, the goal, the aim, the measure, and the analytics. Analytics. Ang uban dili siya mo consider sa analytics kay more on kanang technology man gud ni siya. So usually ang program lang jud mostly sa mga sa quality improvement is kanira siyang four: the problem, the goal, the aim, and the measure. But they added the analytics because mostly ang mga tao karon is using the internet. So mao nang ilan na siyang giapil ang the analytics. So let's start with the problem. The problem, all successful quality improvement programs start with an in-depth understanding of the problem. But what's equally important is system-wide buy-in for the quality improvement initiative and the problem it targets. So maguna jud ta sa problem so that we will know what we will solve. The goal. The goal determined the appropriate quality improvement goal can be a daunting challenge for most health systems. While it's often tempting to pursue incremental improvement gains in the same focus areas, healthcare leaders need to target improvement based on the return of investment and cost benefit analysis. Health systems should ask several questions when defining their quality improvement goals. So that question is, how does this tie into our organization's strategic improvement? What will have the biggest impact on patients? What areas have the largest variation? And what will have the biggest impact on cost? So mo na siya ang mga variable para makuan sa goal. The third is the aim. So aim breaks up the work of achieving the goal into a manageable pieces. So you will achieve the goal one by one. The measure. There's a big difference between a quality improvement initiative with a result and one with an improvement, a distinction that can only be made by measuring baselines and actuals. So measuring baselines is so critical because it enables health system to determine if there is an improvement and if how the improvement is correlated with the intervention. So mao nang the measure. So usually ang uban i-incorporate nila ang the measure to analytics. Kay who will measure your if the problem is solved. 'Di ba usually ang uban na wala pa technology is more on kanang unsa ni ma-admit ang patient magkuan mo ka ng survey kung how was the service and how was mga ingon ana. So diri man good is more paperless naman good halos tanan. So more on nag-rely mi sa mga kanang unsa ni ipislit lang gani kung are you happy with the service, so mupislit lang ka og smile. Kung dili gani smile, so mangutana siya what happened and ana. So at least makabaw sila kung unsay kailangan nila i-improve or unsay if the improvement is attainable or not. So the analytics plays a key role in bringing out the clear insights in a highly confusing world of healthcare quality improvements. It allows easy achievement of quality care cost, patient experience, and most importantly, the effectiveness of the improvement done so far. Right analytics help healthcare units to validate the measurements with smooth data sharing. So it won't be wrong to conclude that quality improvements are powerful enough to transform healthcare and its function. So for example, sa sa quality sa customer service quality. So katong pag-admit nako like nanganak ko, after nako nanganak they have a like survey or quality sa ilahang customer service kung if the doctor came to me every day, unsay mga service nga kinahanglan nako nga wala nako na wala nila na meet nya, if the cleaners are kanang naglimpyo ba sila twice a shift or how was the service ana gani. So dili lang siya kanang pertains to nursing, but it pertains to the whole group as well. So kung if ang doctor unsa daw ra sa usually alas 9 man mo round ang doctor. If the doctor will do rounds at 11 or 12, so ilang ipakita sa doctor nga, doctor, as per our, like, it shows here in the system that kanang dili ka unsa ni, wala ka na round sa imong usual nga round time or gingon ana. And also in OPD, the kanang no shows, it shows nga ngano mo question sila sa doctor nga, doctor, why you have many no shows? Is your quality care bati nga why ngano di mamalik ang mga patients? So mao na siya important ang analytics in improving in quality improvement. So what is quality improvement in nursing? Quality improvement in nursing is similar to the continuous quality improvement in nursing and to continuous quality improvement in healthcare overall. So confusing siya. The term continuous quality improvement and quality improvement are often interchangeable in healthcare, as this is an old term of quality insurance. So what are the goals and objectives of nursing in the quality improvement? So safety. Quality improvements, especially those led by technology, help healthcare organizations to provide the right healthcare to patients that can help them without any harm. But before upgrading to next generation quality improvement approaches, they should be guided properly with the respective information to make efforts in the right direction. So promote patient safety through identifying and responding to high-risk patient safety areas, such as potential quality of care issues, sentinel events, potentially preventable admission and readmission, and adverse pharmaceutical utilization patterns. So, ang concrete example ani is sa JCIA, they have IPSG. One of the IPSG is identify patient identification. So if you identify patient, you should have two identification. It's either birthday and their health card number, or their name and their name and their birthday. So it depends on the organization unsa ilang pilion, if it's either health card or name, or health card or birthday. So usually here it should be birthday and health card number. Kay daghan man gud og names nga pareha diri, like Muhammad Rashid Al Nakbi, nana po Muhammad Rashid Al Nakbi Al Falasi. So mag-change murag same sila og third name, but last name na lang, ang last name ilahang lahi. But you cannot expect a nurse to call five, especially Filipinos, dili ka mo call og five ka names just to identify the patient. So just to lessen like ang diri is their birthday and their health card number. Effectiveness. The healthcare industry couldn't afford risky improvements. They want services that can benefit them and the patients. They strictly refrain from services that aren't like to be any benefit or significant improvement in the care intended for people. The third is person-centered care. In healthcare, patient-centered care has to change patient-centric care. They need the advanced quality management system that can help them serve individual preferences, coordinate and integrate care properly, inform and educate patients, physical comfort, emotional needs, involve family and friends, maintain continuity and smooth transition, and personalized access to care. This helps to align patient care with all clinical decisions. Diri bisan OA kaayo ang mga patients moangal if walay hot water, walay cold water, because they murag kinahanglan nila dili lang ang patient gani ilahang i-cater nila ang family and as a person kung unsay need sa patient. So mao nang it should be total mura kag nag-assist og patient in a hotel. So mo na ilahang kuan diri. Timeliness. The appropriate quality improvement may help reduce in process delays, in which sometimes become harmful for both the parties and involved. the one receiving the healthcare and the ones who are responsible to provide care. Last, one, two, three, four, five. The fifth is efficiency. Efficiency in healthcare amplifies lesser waste, be it of equipment, medical supplies, ideas, and even energy. There is a need for quality improvement that can make processes efficient, keeping the product and effort wastage to a minimum. So, like sa infection control, so naami waste bin na general waste, which is black, and then the yellow waste, which is infectious or kanang infectious waste. So kinahanglan sakto jud nimo og butang ang imong general waste ug ang imong infectious waste like the gloves and all, because uh, infectious waste is mahal siya if imo siya i-throw, murag mahal siya as murag sa timbang ba, mahal siya nga waste compared sa general waste. Nga mao nang strict kay sila when it comes to unsa asa ka maglabay. It's either general or infectious waste, kay as per them mahal ang infectious waste kung ila na ilabay. And the last is equitability. Healthcare should be provided without any biases or gender, socioeconomical status, ethnicity, and geographical location. Quality improvement should be introduced keeping the same into considerations. So what are the roles of staff in the QI programs? So healthcare professionals, including nurses, play important roles in quality improvement in nursing. Sometimes these healthcare professionals may come together as organized groups to shape the role of nursing care in the healthcare industry. Here are some important titles and groups. So nurse executive, this person sets up the structure and ensure the resources are available for the quality improvement work. So dili ka member of the quality or mo handle og quality program if you are not licensed, if wala ka kapasar og quality exam. So they have a specific exam for you to take so that maka handle ka og quality nga mga quality program. Nurse manager. So nurse manager oversees staff, nurses, and can implement a structure to encourage quality improvement. Quality assurance coordinator. These persons assist in executing quality improvement processes and collects data to show that the organization meets the requirements set up by the insurers and regulatory agencies. Quality circle, quality councils, and quality improvement forums. This group help coordinate effective quality improvement care. Next is quality improvement nursing teams. This team focuses on specific ways in which professionals can improve nursing and healthcare in a facility. So, like for example, naa siya in one hospital na ay quality team. So, in the quality team, naa say nurse, quality health nurse. So ang mo na siya ang head sa quality sa hospital in nursing department. This quality head nurse, nasa na siya quality link nurses in each department sa unit. Like if OPD na mag-assign me og quality link nurse sa ward, nasa sila quality link nurse, and they will like every month they will have a meeting so that para kung unsay mga update sa ilahang group mo na ila ipass or isulti sa mga staff nurses. So the last is staff nurse. So this person has the most direct role in delivering healthcare to patients and seeing where care isn't as effective as it should be. So Heather Lavery said, a continuous quality improvement expert and a CEO of Sparflow, These nurses generally do not deliver direct clinical care, but focuses exclusively on observing and determining how to improve healthcare and nursing care within the organizations. So examples include analyzing treatment protocols for patients with chronic heart failure or sepsis, or determining how to improve protocols in order to avoid wrong site surgeries, operations performed on the wrong arm or hip, for example. So, ano siya? Example are kanang usually na may timeout sa it's a timeout paper sa OT or sa OR nga before mo start og operation ang doctor, they will tell which site, and the doctor also will mark the site even before pa musud sa ER sa OR ang patient para walay negligence sa both sides sa nurse o sa doctor. So nurses' vital role in healthcare. There are two reasons for their unique perspective on this issue. First is they are around patients all the time and see the problems and inefficiencies firsthand. So, as per Stephanie Sergeant, you hear people describing the sharp points of healthcare. Those individuals at the sharp points are those actually laying hands on patients, doing the work of patient care. So most often, those are nurses, she says. Through her work as a nurse, I really understand the problems and where there were horrible inefficiencies or gap in quality and areas of risk. So murag kita ang mo feedback sa ilaha kung unsay effective or unsay problem or unsay mga inefficiency sa ilang program para ang kato mga nurse quality nurse mora sila mo improve sa program. And nurses also understand most parts of the health organization's system and processes. So, as you all know, that nurses comprise a big part of the healthcare organization, but sometimes kita pod ang pinaka murag left behind. So it's like, for example, when an organization works for decreasing pressure ulcers, nurses understands how an organization nutrition help expert can help, because nutrition can have a bearing on the skin breakdown more easily, or the nurse will know about the vendor that provides a hospital bed and changes that could be made to decrease bed sores. So the nurse knows all of the stakeholders, as per se. So some of the ideas of the nursing quality improvement. So improving healthcare communication about individual patient during shift changes of nurses or other healthcare professionals, improving nursing teamwork, improving patient safety by improving nursing workload, preventing catheter-related infections, preventing falls and injuries in patients within healthcare facilities, preventing pneumonia that can come from airway ventilators used on patients, cold ventilator-associated pneumonia, preventing pressure ulcers in patients within healthcare facilities, reducing medication error, reducing nurse fatigue and stress, and reducing staff turnovers among nurses. So an example of the improving healthcare-related communication about individual patients during shift changes of nurses and other healthcare professionals is the S-bar. I don't know if unsay ginagamit sa Philippines karon, but here we are using the S-bar. So S-bar is like a situation, background assessment, and recommendation. So every shift sa amo every shift, di ba, sa pag mag-endorse ang nurses, ilan na to i-update ang S-bar, and then they will print it whole as a whole in the department. So ang mga nurses nga na-assign palitan 1 to 12, so ang first nurse is na-assign sa 1 to 3, adto ra sila mo adto sa computer, din dito na sila mo adto na nila i-update unsay update sa patient, unsay update sa kanang kuan. Then after sa shift, i-print to sa team lead para mo na toy kwaon tanan, mo na toy basahon sa next shift. Ideally, kung palitan, ideally jud kung naay mga JCI accreditation and all, i-rounds yun na nila from 1 to 12 patients, so that all nurses knows about the patient. But But reality itself, dili makaya, cause if you will do runs from 1 to 12, luoy sad ang nurse nga outgoing, makauli siya og from if 7 to 7 ang shift, makauli siya og alas 5, alas like 8 or 9. So mao nang gi-update lang nila tanan in sa usa ka paper. Then if pangutanon ka sa imuhang charge nurse kung unsay nahitabo sa room 1, even if it's not your patient, maka-answer gihapon ka. So another example is nana siya policies and procedures about preventing catheter-associated urinary tract infection. So na siya issue date and nasa siya revision date. So kung naay mga makita ang organization nga dili effective ani nga unsa ni nga kanang nga policy and procedure, so kinahanglan i-revise ni nila. If wala ra, ilan na pud nang i-change lang ang date kung wala ra mga kuan. So na siya purpose, na siya definition kung unsa ang CAUTI, unsa ang expected outcome, then policy statement. So as a nurse, kami po diri ra pud mi mo rely kung unsa among techniques, unsa amo ang kanang unsa among buhaton if naay patients nga naay catheter. So at guide po na siya as well sa nurses. So mao na siya, it's just an example nya. Naa po siya yung mga references, related document, and so mura jud siya. So ano siya, hospital-wide KPI, unsa ilang base nga nakahimo sila mga ingon ani nga policy. So mo na siya, so ilan na siyang i-revisit after 2 years kung unsay mga updates. Usually ang infection control mo kuan ani, and usually sa unit naa sila bundle. A bundle means like kung naay mga incidents nga naay kanang CAUTI sa imuhang department, magsuwat ka og paper what happened ana. So para ma-assess nila nga for this period of time kani daghan og urinary catheter infection, then after sa implementation ni ubos siya. So mao na ilahang base sa unsa ilahang buhaton. So next is continuous quality improvement. So what is continuous quality improvement? Continuous quality improvement is a journey to satisfy the needs and exceed the expectation of our customers, a means of performance improvement, and it should be aligned with our mission to improve the lives of our patients, families, and communities, to educate skilled healthcare professionals, and to conduct research that expands clinical knowledge. So it's always focusing on the customer satisfaction. So diri ang mag-una sa hospital, if you will enter the hospital, mag-una jud na ang counter sa customer service, or customer, as they say, customer happiness. It speaks for itself. They want to make the customer happy. So even if ang waiting time nimo sa imong doctor 30 minutes ra kagahuwat, issue na kay na sa organization nga 30 minutes ang patient. So kinahanglan kung unsa ang time sa patient nga booking, if ang booking sa patient 9:20, kinahanglan 9:20 or 9:25 kitaon na nimo siya, or else naa na ni-report nga ngano gipahuwat nimo ang patient for 30 minutes to 1 hour. So that's what does CQI encompass? So they encompasses patient satisfaction, patient care, patient safety, employee safety, employee satisfaction, regulatory agency requirements, administrative and financial functions. So kani siya usually ang usahay ang makalimtan lang jud ani no kay employee satisfaction. More on they will focus on patient satisfaction because they are the ones who we care for. Mo na ang usually target sa organization. But they should also consider the employee satisfaction 'cause, like especially karon nga daghan na kaayo resignation sa mga nurses. So if you won't satisfy your nurses mo nang daghan kaayo turnover kay workload itself nga daghan na kaayo. So mao nang kung dili ma-satisfy ang employee, so magdaghan mang resign, which will affect the organization and also will affect how the nurses care for their patients. So what are the CQI principles? It's all work is a part of a process. Quality is achieved through people. Decision making is done with facts. So evidence-based naman ta halos tanan. Patients and customers are our first priority. Quality requires continuous improvement, and CQI focuses on the process and not the person. So, if na kay sentinel event or incident report, like pastoryahon kanila why what happened, why like this. So they will not blame you as a person, but they will check unsay improvement para dili na ni ma-happen na incident sa especially sa customers, like ngano nagminalita ka sa customer, what happened, so the next time you will deal with the patient, what will you do, and like that. So it's all focused on the how you will treat the patient because it's the first priority of CQI. So the methodology of improving a process, you need to find a process to improve, organize a team that knows the process, clarify current knowledge of the process, and understand what causes the process variation, and select the process of improvement. And it's just an overview. So this is how the CQI um, is done or formulated. So you need to form first CQI team. Then you need to collect data, ensure data quality, then present data, disseminate chart. So mo na nang i-report sa sunod nga group because of the chart nga ilang gamiton para makabawta unsay mga kinahanglan i-improve and also mo na siya. So identify areas of improvement, create process maps and key drivers, generate PDSA test cycles, track and interpret results, identify lessons learned, engage in wider testing, and disseminate results. So usually diri quarterly may magkuan sa among KPI, like sa infection control kung ang nursing dili siya ka-achieve sa unsa ang benchmark. So they will inform the head of nursing, like sa chief nurse nga, oh, your nurses are not washing their hands properly, you do like this and you do like that. So after the next quarter, if mo improve ang nursing compliance with hand washing, so makaingon sila nga, okay, it's effective. So last is the examples of CQR projects, like early recognition of sepsis through electronic medical record, preventing central line and catheter-associated urinary tract infection, and minimizing pain during procedures for pediatric patients, ouchless. So diri, I don't know kung sa Pinas, di ba, usually kita kay kung naay doktor usay kusion ta sa atong parents nga sige na diri ayaw na sige inarte dira pagpa-inject na, but here dili pwede ang parents kinahanglan ang patients dili pwede matrauma. So it's either ang patient imo siyang hatagan og two choices. It's either mag-emla cream ka. Emla cream is like mura siya munam sa imuhang site nga injection para di lang jud ma-ouch ang patient, but still there's a sensation, or kanang spray itself is like a cold spray nga munam pud siya sa site para ika-inject nimo, mura ra siya wala sa patient. So ingon ana pud siya, and kung if mo naami mga procedures like kung mga intensive na jud like casting or ani. So naami laughing gas. So laughing gas amo ra na ipa-puff sa patient para magkatawa sila, dili sila ka-feel jud sa sila maka-feel sila sa pain, but less because because of the inhalation that we are giving. So it's just laughing gas pero nitrous oxide ra gud siya pero magkatawa ra jud ka. And that's it. Thank you for listening. Any questions?
All right. Thank you, Kim. No, so what Kimberly was sharing is more into their JCI practice, I believe, no? Because I was able to relate based on the examples, particularly with the ISBAR format. Your format, Kim, starts
Yes.
with letter S, no? The situation directly. In our hospital, we start with the introduction and we call it as ISBAR. No, so in the introduction, in the situation, I've noticed that there is an introduction of the name of the nurse already, addressing the doctor. However, in the introduction, it has something to do about the introduction of yourself, no, and the reason why you are referring to the doctor. So, say for example, Doc, good afternoon. This is Adriel Pizarra, staff nurse of General Nursing Unit 3. I am here to refer you a patient who is experiencing hypertension. Ayun, anak siya. And then for the situation in the background, with the situation, I will be giving an idea to the doctor what is going on to the patient or what the patient is experiencing right now. But the background has something to do with the highlight of the referral. No? So say for example, Doc, karon nihatag ang ako ang nurse as a charge nurse who's speaking to the doctor trying to refer it with the unusuality. Doc, akong charge, ako ang handle nga nurse, Doc, nihatag og tambal sa pasyente karong mga alas 8 sa buntag. Before siya nihatag, Doc, nagkuha siya og BP. Ang BP was 150 over 90. Taod-taod na nibalik after 30 minutes, ang patient nireklamo na nalipong siya og kasukaon. Nag-BP ang nurse, ang BP sa nurse, ang BP niya kay, ang BP nakuha kay 140 over 90. So, unsa atong pwede buhaton? So, what is the situation all about? The situation is about referring a patient who is experiencing hypertension, and the background highlights with the side effects of the medication, which causes dizziness as well as so itong usa dizziness, no, which is the highlight, okay, o nalipong, no. And then assessment wise, since ISBAR has an assessment, latest vital signs nako, Doc, mao ni siya heart rate, RR, temp, BP, O2 sat. So that can be a very good assessment. And the resolution would be, Doc, unsa man ang atong buhaton ani sa patient, imo lang siyang sakaon. Okay, so usually we do it every time we do telephone order, telephone and verbal referral, Kim, no. So in your end, Manggod, no, your ISBAR is being done in terms of the entirety of the nursing unit, no. Ang sa amoa lang is when we do refer it to the doctor if there are unusuality with the patient with that format.
Okay.
That's yeah. And yes, and also you've mentioned bundles of care, no? These bundles of cares that we have as well in the hospital has been implemented right after we've cascaded JCI policies, no? In our hospital, Manggod, although we are following only the protocol of the DOH, who is the standard policies of DOH is what we are anchoring right now in our hospital. We do have this corporation coming from Mount Grace. Mount Grace is a type of corpo, no, who is adopting hospital as part of their business, no. So FINMA is more into education, no. Our institution is governed by FINMA, which is more into education in terms of their business. So they don't know how to manage a hospital. That is why they are trying to seek help from Mount Grace to manage the hospital, because they can't also give up the hospital due to the affiliation of the paramedical courses in the tertiary level, no, particularly nursing, medtech, radtech, PT, no. So they cannot afford to lose the hospital. However, they see it as a liability because they are not gaining income from the hospital, particularly during pandemic, no. So we've consulted Mount Grace. So ang gibuhat karon is with a private negotiation, 50-50 ang ilahang bahin, no. And then these two are implementing different policies, no? Sometimes it leads to confusion to us. However, we need to abide whatever are the rules, regulations, and of course restrictions that they are being implementing. Now, Mount Grace is very particular in terms of standardization because most of their hospital in Luzon are JCI hospitals. That is why even though that we are a DOH anchored hospital, we are trying to utilize the GCI policies. No, so I kind of relate to what Kim was saying as well. Okay. All right. So that's part of quality improvement, guys, and continuous improvement plan. No. The main difference is that when you hear the word continuous, that means to say that it should continue not just in a particular year, but on the succeeding years. Always remember that there are spot audits that are being conducted, and with those audits, no, they can even ding you if you're not following what is written. No, and JCI is really tedious because you have to revise your manual from time to time. So if it's not part of the practice anymore, there should be a revision. You cannot just obliterate what is being written in the past, but it should be well cascaded to the upper management with the MANCOM and EXICOM. Okay. And definitely, no, I really agree what Kim was saying in terms of patient satisfaction. We have to consider, Jude, na every time we do care to our patient, we also have to add the ingredient of customer service and customer so that patient would experience customer satisfaction, no, or care satisfaction coming from us. And that can be measured through evaluation. No, we do have quantitative way of evaluating these measures, knowing, making it sure that patients can somehow get the right service, not just safe and quality care, but also with a twist of customer service. No, right? So I think that will be it the for this particular unit. But we've missed one unit, which should be reported by one of our students, Miss Cabinas. No? So I'll be inserting her next meeting. That would be with Miss Unabia's group already. No, maybe she can present first, Miss Unabia, and then followed by your group. So let's
Okay po.
all right, thank you. Let's go on now with unit 6 and 7. These are actually the tools right now, as well as the continual improvement methods, no, or methodological way of implementing our CQI. And we have Miss Labiste's group now. While they are preparing, guys, do you have questions from them? Okay. By the way, before I forget, katuganing bundles of care, we do have the CAUTI, the ventilator-associated pneumonia. No, those are just very good example. How do we apply this one? Once the patient is admitted, we have to check our patient if we were able to do interventions to make sure that patients couldn't get those kinds of infection inside the hospital. So we do have a checklist in our hospital in which staff nurses will check it every shift, no, AM, PM, and night, no, and they're going to check those interventions if they implemented it. That is to make sure that they're able to provide independent nursing care and at the same time dependent nursing care as much as possible, and also collaborative nursing care as well as part of the checklist. So it's just yes, no, yes, no. Have you done this, Anna? Did you wash? Yun, Ana, did you change? Yun, Ana, siya, no? So once the staff nurse will affirm that they've done everything, that means to say that our patient are safe. Okay, that's the bundle of care. It's just a one page actually. No?